I'm Dr. Karen Horridge, Disability Paediatrician in Sunderland in North East England. This video podcast accompanies my editorial in Developmental Medicine Child Neurology, introducing the Each and Every Need report, which launched in March 2018. This was led by the National Confidential Inquiry into Patient Outcome and Death. I commend the editorial to you and also, of course, the report itself, which looks at the quality of healthcare for children and young people with cerebral palsies as exemplar disabling conditions aged from 0 to 25 years. I'd like to share some of the key clinical findings of the report with you. We chose the cerebral palsies because of their broad spectrum of severity and wide range of associated conditions. The study involved a range of case note reviewers from the multidisciplinary team, physicians, paediatricians, therapists, who scrutinised the medical records in great detail to look at what was documented about aspects of healthcare. The reviewers reported significant room for improvement in a range of aspects. This included the precision of diagnosis, including description of tone variation, which wasn't documented in all cases. Functioning, including the gross motor function classification system level, wasn't there in over 2/3 of cases. Pain, that major determinant of participation and quality of life, well evidenced, wasn't always inquired about and wasn't always well managed. The patient's weight wasn't always recorded in up to 4 out of 10 cases, and yet accurate weight underpins accurate calculation of antibiotics, botulinum toxin, and any other medication. The wider needs of patients weren't always documented: their level of learning ability, their preferred communication method, or their social functioning. Room for improvement in multidisciplinary working in general was noted by reviewers in about half of all cases, including on transition to adult services. There was also significant room for improvement in the inclusion of patients themselves in discussions and decision-making about aspects of their care. There are 35 recommendations in all. I commend the report to you because I believe that if all the recommendations were implemented, and many are resource neutral, there would be significant improvements in outcome opportunities for all with disabling health conditions. Thank you for listening.